Hello everyone, welcome to Psychology 303, Analysis of Everyday Behavior, and today we're going to be talking a little bit about shaping. So previously we've discussed some of the techniques that we can use to introduce new behaviors or novel behaviors. We talked a little bit about prompting and fading, but today we're going to talk about a new technique that is used when we want to kind of introduce new behaviors that the target individual doesn't already perform, and that is shaping. So you can think about, well, if you want someone to be able to play a complicated piano piece or maybe do ice sculptures, you can't just kind of teach them that behavior. When you think about it, you have to kind of gradually get them to perform specific behaviors so that way they can kind of build these behaviors up to be able to perform that complex behavior that you may want them to get to at the end. So great examples of the use of shaping are any real behaviors that children learn. When you think about how children learn to do what they do, how they learn to talk, walk, crawl, eat, all of these new skills, they don't have these skills. They have to kind of learn them somehow. They have to get them taught, obviously, by their parents. And as they practice them and perform them more and more, they become more adept at performing these. And when you think about, for example, a child talking, at first the child's just going to make little babbling noises, maybe little ah or ooh or ma or da syllables, for example. And whenever the baby does that, the parents are going to get really excited, thinking that the child is talking. So they're going to reinforce that behavior, the making of these little noises or these syllables. After a while, the parents start to kind of get used to the baby talking this way. And so the baby has to kind of do more or get closer to actually talking in order to get the parents excited and in order for the parents to reinforce it. So instead of simple syllables, they may say syllables or combinations of syllables that resemble words, such as dada or baby or mama. So that way, when the child says those combinations, they get reinforced, and just the simple syllables or simple noises, such as ooh or ahs, they are no longer reinforced. So we're reinforcing a more complicated form of talking that's closer to this kind of end goal of actually communicating and talking. So you can think about shifting from simple syllables to combinations of syllables, shifting from combinations to actual words, shifting to combinations of words, and shifting to actual sentences, actually grammatically correct sentences. And you can see how when the next step appears, that's going to be reinforced, and the previous step is no longer going to be reinforced. And that's really the kind of basis or the foundation of what shaping is. So if we want to get into kind of a definition of shaping, it's developing a target behavior, again, a target behavior that doesn't already exist, and we use what's known as successive approximations to gradually kind of lead or shape the behavior into that desired final outcome. So again, I just used the example of talking, how we encourage a baby to go from saying simple sounds to complex sentences. We can think about any number of other behaviors that a child might do. A great example would be walking. Developmentally, you see children sit up. Every time a child sits up, that's a little bit closer to walking than laying down, so that's going to be reinforced. After sitting up, you might see a child start to crawl. That's going to be reinforced. That's a closer approximation to walking than sitting up. So crawling is reinforced. Sitting up is no longer reinforced. And then you would slowly start to see that shift into every time the child actually walks, you see that reinforced, and crawling is no longer reinforced. So again, we're reinforcing that target behavior or the closest approximation to the target behavior that the target individual can perform, and not reinforcing any of those other behaviors that might have occurred to begin with. So in order to use shaping, yes, we're introducing this new behavior. Yes, we have this kind of end behavior that we want to get to, but we have to first identify, all right, what is this starting behavior? What is the behavior that we want to reinforce that isn't really like that end behavior, but we think we can gradually shift it to that end behavior? So again, there has to be a behavior that the person or individual already does. You reinforce that. And here's where the tricky part comes in. You then stop reinforcing it. You then use extinction to, in a sense, discourage that behavior, but what we're really looking for in shaping is the extinction burst. And if you remember, that extinction burst is when a behavior that someone performs all of a sudden isn't performed anymore. They're not getting that reinforcement, oftentimes attention. And when the target realizes that it's not being reinforced, they try to do other things to get that reinforcement, to get that attention. And the idea here is that as part of that extinction burst, some novel behaviors should emerge, and ideally what you want to do is look out for behaviors that are a closer approximation to that final behavior and then reinforce those. That way the child or individual will shift to that closer approximation and then forget to or not want to perform that original behavior. So there is a bit of an aspect of, I don't want to say luck, but an aspect of you kind of have to wait it out and hope that the individual will slowly start to make their way towards that ideal behavior as part of the extinction burst. And again, once they move to that next behavior, reinforce it just enough to where they continue to do it, use extinction, wait for another extinction burst, reinforce the behavior that's a closer approximation until you finally, through that process, get to that target behavior that you want to in the first place. So that's the premise behind shaping. So it's the kind of best way to understand this is that it's a gradual shift from a behavior that a person already does to this ideal behavior. And it's an ideal behavior that the individual doesn't perform at all. So lots of research has examined shaping, especially with animals, teaching rats to press a lever. We've used that example, the Skinner box example before, but you can think of, what if the rat doesn't press the lever to begin with? Well, if the lever is on one side of the box, you would reinforce that behavior and not reinforce it if they're on the other side. You would reinforce it if they start to move towards the lever, if they start to actually touch the lever, and then once they start to touch it frequently or actually press down on it. Along with animals, probably not surprisingly, we can also apply this to humans. This is frequently used to introduce novel behaviors. Say, for example, an individual who gets into a car accident, kind of teaching them how to use some new technology to help them get around. It could be used to reinstate a previous behavior that a person maybe performed but hasn't performed for a long time. So say, for example, a person used to run all the time. They got a hip injury and then they no longer were able to physically run because of their hip. Getting hip surgery, you want to maybe teach them how to run again, how to be able to perform that behavior. You would gradually, using physical therapy to help an individual recover from an incident and help them get back into the shape that they need to be. And in certain situations, it can also be used to change basically a dimension of a behavior. There's research out there in which shaping has been used to do this, but for the vast majority of times in which shaping is used, it's to introduce novel behaviors, and then we also see some situations where it's used to reinstate a previous behavior. But there are some kind of offshoot uses for shaping that can be extremely helpful. One thing about shaping is that it probably occurs a lot more often than people realize, and the way it occurs is by reinforcing undesirable behaviors. So I'm sure all of us have been in a situation where maybe someone's doing something to annoy you, or maybe try to get your attention when you really don't have the time or the patience to be able to pay attention to them. And so because the other individual is not getting reinforced by their attention, they try and do something crazy, and they end up getting your attention as a result. And then they start to realize, okay, all I have to do is do that crazy thing to get their attention, and they stop doing the thing that they were doing before. So a more concrete example of this would be a child who wants mom's attention. Maybe what they did before was just tap her on the leg, but she's really busy. The tapping's not working, so the child starts screaming. Well, the scream gets mom's attention because mom's not used to hearing the child scream. So mom gives their attention, and now the child thinks, okay, if I scream, I can get mom's attention. So the child now starts to scream a lot more often. Mom has no idea why, just all of a sudden it starts to happen. So mom is paying attention to the screaming and starts to get it acclimated to it, starts to get used to it, and starts to ignore it. And so the child realizes this and then starts to do crazier things like throwing tantrums on the ground in order to get mom's attention. It happens because mom's not used to the child doing that, and we see again, tantrums become a common theme. Mom has no idea why. Well, it's because shaping is occurring. The screaming, after not being able to get mom's attention from tapping, is an extinction burst that is being reinforced. The tantrums, after not being able to get mom's attention from the yelling, is an extinction burst that's being reinforced. So sometimes we have to undo shaping, or just at least recognize that shaping is occurring and is the reason why these undesirable behaviors might be occurring. There hasn't been a whole lot of research examining how shaping influences undesirable behaviors, because in a lot of ways you don't want to increase the likelihood of undesirable behaviors occurring in adults or children. It's kind of unethical. You don't want to do that. But there has been some preliminary research in some animals, rhesus monkeys for example, that does lend credence to this theory. So in using shaping, there are obviously a lot of important considerations to make. Probably the most important consideration is exactly how much you reinforce that successive approximation each time. And it's kind of a fine balance in between, you want to reinforce the behavior to encourage it to occur more frequently, but you don't want to reinforce it to the point where extinction is going to be difficult to implement. Because again, you want to reinforce that approximation, but it's only an approximation. It's not the desired outcome. You then are going to want to extinguish that behavior, encourage extinction bursts, and move on to the next approximation. So that's all I have for shaping. A really nice tool, something that, again, you might see more frequently than you realize. But thank you all for your time and attention, and I will see you on the next video. Bye.